we have invited her under slightly false pretenses because Nancy Parker is actually the 2025 Outstanding Ship Volunteer Award winner. So congratulations, Nancy. And I want to, before I turn it over to allow the folks in Tennessee to say a few words, I want to read out a lot more about Nancy. So Nancy has been part of the Greater Nashville Regional Council for over a decade. And in the nomination for the Outstanding Ship Volunteer Award, this is what her colleagues had to say about her. Through several staff transitions, Nancy has remained the stable source of information that has carried the program through phases of understaffing and challenges like the COVID-19 pandemic. Most months, she does more counseling sessions than our staff, freeing them up to take care of scheduling, reporting, and administrative planning duties. She is an incredible force of nature you can always rely on to give the best care and information possible to help others live well. Since January 2019, Nancy has contributed an incredible 6,526 hours to SHIP. During this time, she has conducted 7,342 counseling sessions, staffed 40 informational booths at various health and community fairs in Middle Tennessee, and given 7 presentations to educate beneficiaries and spread the word about SHIP. Her counseling sessions led to 686 plan enrollments to better meet the beneficiaries' needs, saving her clients $2.2 million in prescription drug costs. And that number would be far higher if it included savings for the beneficiaries she helped apply for the various aid programs or provided general guidance to. One story that sums up her dedication comes from our Medicare counseling coordinator. On April 13th, 2022, I received a highly unusual message from Nancy stating that she would be unable to present at the senior center the following day. A tree had fallen on her roof, destroying much of her house. She was in danger amid a storm with her home and possessions in shambles around her, and yet she called to make sure that the people would get the Medicare information they needed. When I called her back, she wanted to discuss presentation logistics while I was focused on getting her safely out of that unsafe situation. All through the months with her relocation, new water damage, a robbery, and all the other difficulties of restoring a home, she has continued to volunteer and continued to use her unique abilities to help others. Nancy always comes through for us, whether it's helping a Medicare beneficiary obtain vital services, counseling outside on a hot day, or giving a Medicare presentation. A retired nurse, her knowledge and dedication have helped thousands. We and the many beneficiaries she has helped are incredibly grateful for her commitment. She is truly exceptional. Congratulations, Nancy. We are so proud of you, and we would like to turn the floor over to you and your colleagues in Nashville to say a few words. And I know they are there in person. Congratulations.
Thank you. I admit I work hard. I have been doing benefit administration literally since the 70s. I was working as an occupational health nurse and administering the benefit. The group health plan came to me. In addition to that, the owner was covered under the plan and had Medicare, which of course started in '65, the year I graduated from nursing school. So it's what I have been doing my whole life. I've been in benefits in different ways. I've done workers' comp, and people don't understand insurance and health insurance. I just gave them some information. One thing I say to people all the time is you're normal. And those 2 words frequently really help the beneficiaries because they don't understand it. And just knowing you mean I'm not the only one, that can take a world and take a load off of them. Things are constantly changing. As far as, yes, the tree fell on my house, no, the work is not done yet. It's actually now in the hands of an attorney. Thank you very much. But life goes on. I'm now by myself. I need something to do with my days. I'm retired, and it's a perfect fit because I was working from home before I retired. I can go into the office and do the calls. If I've got something I need to do, I go do it. So I have no problem doing it. People need it. I've got the information and knowledge, and me taking it with me isn't going to do anybody any good. So I'd rather spread it around, and frequently I'm talking to people and I'll tell them you're normal and I'll explain it, and you can tell they don't understand it, but they say, okay, and you can tell it's starting to gel. There was one woman recently that she just understanding the terms, deductible, premium, what's the difference? And I finally gave her a suggestion. I said, go to your Medicare and You handbook, dig it out, it's dry reading, but read through those definitions. And I think that's going to help you more than anything else, because it's just some of the basic things that you don't get a course on it in high school, especially anymore. So I thank you, I appreciate it, but I appreciate you too. I don't know what I do with my days. I enjoy my reading, I enjoy doing my embroidery or my knitting, but I can't do that every day for 8 to 12 hours a day. That would just, it doesn't keep my brain active. So thank you very much, appreciate it.
Well, we are so delighted to be able to benefit from your free time and your experience. And I do want to allow, is your colleague Rebecca in the crowd?
Right next
Would you
to me.
like to say a few words as well?
Yes, just want to say we're really, really grateful to have Nancy here as part of our SHIP team. She's really I don't know what the program would look like without her, because she's been here before I started at GNRC, and so she's always been here.
Diane's been here longer, but she's probably about the only one.
Yeah. So we are grateful to have her, and it's such an honor to have been able to nominate her for this award.
Well, it's been a great fit too. I mean, things just gel.
That's wonderful.
Nancy, can you see all the congratulations up there?
Yeah, I can't read them, but I can see them.
We'll send you a file of all the congratulations.
Okay, thank you.
Because we're so delighted that you're part of our network. And like I said before, we could not do this work